Hello, everybody. Thank you. I will not talk about ILM inverted flap technique, but I will present our study we just published last month about ILM peeling in vitrectomy for retinal detachment. And we know that formation of ERM is one of the most common sequelae after vitrectomy for hematogenous retinal detachment. In literature, some studies reported that macular pucker occurs in 15% of the eyes after vitrectomy for retinal detachment complicated by PVR. Other studies show that incidence of ERM can vary between 6% and 13%, and we know that these membranes can limit the functional outcome, causing metamorphopsia, and if symptomatic, they require additional surgical intervention. So we performed this retrospective study to determine the differences in rate of ERM formation between eyes that underwent ILM peeling during vitrectomy and those that were not subjected to ILM peeling. We analyzed all cases undergoing post-planar vitrectomy for hematogenous retinal detachment between January 2007 and December 2013, all cases with at least 1 year of follow-up. Data collection included vision, intraoperative complications, occurrence of hyperretinal membrane, and OCT findings. Exclusion criteria: tractional detachment, trauma, post-venous occlusive disease, history of uveitic episodes, presence of ERM in the same or fellow eye, patients with PVR greater than grade C2, and patients who needed intervention for recurrent retinal detachment. Surgical technique was a classic approach. If patients were phakic, we did phacoemulsification too. Core vitrectomy with the PVD induction if not present. ILM staining with brilliant blue with or without PFCL, as you can see in the video. ILM peeling with tenoscraper with or without Eckhart forceps. Peripheral vitrectomy with base shaving and laser photocoagulation 360 degrees. And endotamponade, of course, depending on the type of retinal detachments. We could use gas SF6 or gas C3F8, silicone oil 1000 centistokes, or heavy silicone oil Densiron. So results: total 159 eyes recruited, 32% macula on, 68% macula off, and mean follow-up 16.8 months. So two groups, 78 eyes, 49%, underwent ILM peeling. This is the ILM peeling group. 18 eyes, 51%, without ILM peeling, no ILM peeling group. So you can see in the results, it was significant better, the postoperative vision in the ILM peeling group, 2063, in comparison with the no ILM peeling group with vision of 2125. And another difference significantly important was the ERM formation, of course. In the no ILM peeling group, we had a rate of formation of a pucker of 31%, and the ILM peeling group only 9%. Actually, we think that these cases of the ILM peeling group developed ERM, maybe the ILM peeling was not complete or was not correctly performed. That maybe justify the rate of 9% of ERM formation. We also divided the cases in other two different groups. Patients who developed ERM and patients with not developed ERM. So again, the visual acuity was significantly different. Patients who didn't develop ERM, good visual acuity, 2063, in comparison of patients who developed ERM, only 20/250. And of course, macular thickness was much better in patients who did not develop ERM. So in conclusion, the postoperative vision was significantly better in eyes that had ILM peeling, with lesser ERM formation, and mean foveal thickness was closer to normal. We analyzed that ILM peeling reduced the likelihood of ERM formation by 75%. And also we found that the presence of PVR was seen to increase the likelihood of ERM formation by 5 times, independent of ILM peeling. In such eyes, the ERM should be considered as extension of the PVR process involving the posterior pole, rather than resembling the idiopathic ERM. So we can propose prevention of macular pucker formation by ILM peeling during the primary vitrectomy for hematogenous retinal detachment. But the safety of prophylactic ILM peeling without any macular lesion is controversial, of course, because we know the complications such as retinal edema, eccentric scotoma, DOMFL, iatrogenic punctate chorioretinopathy and subretinal retinal in vitro hemorrhage can happen and can be very traumatic. In addition, stain toxicity has also been documented. So in conclusion, we reported a beneficial effect of ILM peeling in all cases of rheumatogenic retinal detachment undergoing vitrectomy to minimize future occurrence of epiretinal membrane formation, resulting in better vision and preventing reoperation for ERM removal. But even if we didn't report many complications after ILM peeling, the risk certainly exists, especially with the novice surgeon. Thank you.